As you change from your pediatric to adult healthcare team around age 18, there are a couple of things that are important to do. Understanding your adult insurance coverage, choosing the doctors that you need, and making sure that your new doctors have your medical records are important tasks for getting good care as an adult with Spina Bifida. Health insurance can be confusing. To understand your insurance easily, make sure that if you have a social worker at your doctor's office, ask them to look at your insurance plan with you and talk about any changes that will happen as you get older. At 18 years old, if you have a disability, you can go to the Social Security Administration website to apply for supplemental security income. This action may be required for adult Medicaid in some states. Ask your doctor for a medical summary to help with this application. If you don't already know what insurance you have, look at your insurance card to learn the name of your plan, call your insurance representative, or go to the insurance website to learn about your coverage for medications, supplies like catheters, and equipment like braces and wheelchairs. When you are 18 or older, ask your insurance company about any changes in your plan that will happen when you get older. Call your insurance representative to ask questions about coverage for medication, supplies, home health, and any benefits you could get. When planning visits with new adult care doctors, ask your pediatric team for a medical summary and recommendations for adult doctors. Make sure the new doctors accept your insurance plan. Take your medical summary, a list of your questions, a list of the supplies and equipment you need to your first visit. If people on your new healthcare team do not know much about Spina Bifida, think about sharing the healthcare guidelines found on the Spina Bifida Association website to help your new team learn. For additional resources, visit healthychildren.org and aap.org to see other videos related to Spina Bifida care.